Test strategy number 2. Nursing process. Diagnosis. Sample question that involves nursing process, diagnosis. Question number 1. A 65-year-old patient is admitted to the medical surgical unit with a diagnosis of heart failure exacerbation. The patient presents with shortness of breath, bilateral crackles in the lungs, peripheral edema, and fatigue. The healthcare provider orders a diuretic to manage fluid overload. Which nursing diagnosis should the nurse prioritize for this patient? A. Activity intolerance. B. Impaired gas exchange. C. Risk for falls. D. Excess fluid volume. Answer. The priority nursing diagnosis for this patient is B. Impaired gas exchange. Rationale: heart failure exacerbation, which causes fluid to accumulate in the lungs, pulmonary edema. The patient is experiencing shortness of breath and bilateral crackles in the lungs, indicating impaired gas exchange. Impaired gas exchange means that the patient is having difficulty getting enough oxygen into the bloodstream and removing carbon dioxide from the bloodstream. Impaired gas exchange is the priority because it is a life-threatening condition that can lead to respiratory distress, hypoxia, and respiratory failure if not addressed promptly. Proper gas exchange is essential for maintaining oxygenation of vital organs and tissues. Question number 2. A 30-year-old female patient with a history of major depressive disorder is admitted to the psychiatric unit following a suicide attempt by overdose. The patient is tearful, expresses feelings of hopelessness, and states, "Life is not worth living anymore." The patient's vital signs are stable, and she is medically cleared by the healthcare provider. Which nursing diagnosis should the nurse prioritize for this patient? A. Risk for self-harm. B. Social isolation. C. Ineffective coping. D. Imbalanced nutrition. Less than body requirements. Answer. The priority nursing diagnosis for this patient is A. Risk for self-harm. Rationale: given the patient's history of major depressive disorder and recent suicide attempt by overdose, the most critical concern is the patient's safety and the risk of further self-harm or suicide. The patient's expressions of hopelessness and feelings of life not being worth living are significant indicators of potential suicidal ideation. The nurse's priority is to ensure the safety of the patient and address the immediate risk for self-harm.